So once again, we're live. Welcome to Doc Talk Live. I'm Dr. Brad Goodman, and I'm with Ramsey White. Ramsey, thank you for coming on today. If you're new to Doc Talk Live, this is a show to bring healthcare information to people that enjoy or use social media. I appreciate people tuning in. We actually have a show tomorrow around the 5:30 time frame. I'll get to that later. If you're catching this on a rebroadcast and you're watching this, let us know where you're watching from. Let us know what topics you're interested in. Ramsey White with Innovative Billing Solutions really approached me about doing a show. He wanted to talk about patient billing. So I appreciate you coming on, Ramsey. You have a passion to talk about patient billing. So tell me, why is it we're here today? Why did you want to talk about this topic?
Yeah, well, thank you, Dr. Goodman. And again, it's just an honor really to be on here and seeing how
the honor is mine, believe me.
Seeing just how this is growing, and what I like about it is it seems as if we're seeing from the general public that people want to communicate with their physicians, and the more barriers we can remove from that, the better outcomes. And I guess my interest in medical billing, it really kind of inadvertently started in college. I was a communications major at Stanford University, and just always been intrigued by what methods of communication people prefer and choose. And I've seen in my professional career how in medical billing, different age and groups of people prefer to be told they owe money in different ways.
Interesting. Okay. So go expand on that. Tell me more about that.
So, and this is very general. I know we have a lot of people watching, but typically if someone's over 50, they prefer to get a paper bill in the mail.
Okay.
Like a physical piece of paper. And if someone's maybe in their 30s, a millennial down into the 20s, they actually prefer a text or an email notifying them they owe money. And I've done a lot of research on millennials, one, because I am one, but two, just wanting to understand this next generation of patients, how to engage them. And a lot of millennials actually, they don't check their mailbox. And so
their physical mailbox.
No, they don't. It's just it's something where if you're not texting them, if you're not emailing them, or even engaging them on social media, you're just missing the target completely. So
like, and I'm not a millennial, and I'm over 50, but like if I go to the airport and I park, I get this ticket, and then I got to put this ticket in, and really, I just want to be able to like Apple Pay it. Like, okay, I want these barriers pretty much gone. When I go on a toll road, not here in Birmingham, but in other parts of the country. When I go on a toll road, you have to stop, physically put. Who carries money with them anymore?
Cash.
Really, I don't want to do that at all.
Right.
So I think I fit the millennial description.
You do, and what we found is there's outliers. So, depending on who the person is, you may see grandparents texting their family members and using that as a form of communication. But really, what you're talking about with Apple Pay, that's just near-field communication. And what for the audience, I know a lot of people are doing that, but some people, you'd be surprised at how many people aren't doing that. And they don't know how convenient it is to actually tap your phone and make a payment. And what that's doing is it's accessing your mobile wallet, and it's sending a token of your credit card through to maybe it's a merchant or hopefully a toll bridge one day, and it's making that payment seamlessly without having to pull out a physical card.
I have more questions, but there are some comments. I don't know if I can scroll through these and read them.
Right.
Okay, but... And I don't know if I should say people's names or not, so I will avoid that right now. But It says, I prefer online statements and automatic payments per month. That's a comment. I didn't check my mailbox today, to be honest. I didn't either. I wish the charges were itemized instead of one amount with no explanation. Do you have something to say to that?
Yeah, so what it looks like that person's asking is they want details about what they owe. And that is actually why a lot of people do prefer a paper statement because you're sending sensitive health information. And there is still a little bit of apprehension about security over like a mobile device. Like, when you're saying, hey, this so-and-so came to this practice, they got this procedure done, people are just a little weary of exposing that information in a digital way right now.
Why do we need a innovative billing? I assume that you're strictly in billing medical,
yes,
right?
Yes,
so why do we need a separate one for this as opposed to Walmart or Target or more traditional consumer billing?
That's a great.
Why do I need? Why does this business exist?
Well, we're handling sensitive information and we're telling people how to pay. And, HIPAA compliance is a really big deal because, when you think about a patient, some of the most sensitive information they have is a medical condition that they may not want everyone to be aware of. So that's where we come in, is we handle that sensitive information safely and securely.
How do you do that?
We process information from the practice management software, and we send out a bill with the details on it. Actually, we mail
So
paper
do you
statements.
work with like practices like mine, like
Yes,
I'm a
we do.
physician practice, or do you work with hospitals?
We focus on ambulatory care, small physician offices. That's most of our clients.
Okay, so physician offices like mine. So you go in and do we turn the billing over to you, or what is it that you actually do?
So the way we work is we give say an example of your practice, we give you all the tools you need to collect payments. So, if you wanted to use someone like us, you would send us your statement data from your software, and then we would send out paper statements and text email statements to patients that opt in and prefer to pay that way.
And when you say pay what way, what does that mean?
So
People who prefer not to pay by a check?
Yep. So
or a credit card?
Right. We give multiple ways to pay. Like they can pay online with us, they can pay by a text if they want, they can pay by an email, they can send in a check if they want. So we give multiple ways to pay. That's why we exist.
And how long have y'all been around for?
So we've been in business over 20 years, and we transformed many times, but we specifically found a niche with medical. That's where we've been focusing our efforts.
Interesting. See, I think all of, like you pointed this out in the beginning, that healthcare in general, the 50 and over versus the under 50, the way it's delivered, I think we need to. I don't think we need to, but I think the way healthcare is delivered is going to be completely rethought out anyway.
Yeah, I think so too.
And what I mean is, like, there's this company called Teladoc where people get on their phone and they are with a physician via I guess Skype or FaceTime or something like that, and actually not having to go into an urgent care situation or a situation where they're actually going to catch somebody else's virus by going to a waiting room. So a lot of the way healthcare is being delivered is going to change. And so you're on the billing aspect. Do you see, if you look into your crystal ball, what do you see going on with billing, and what do you see going on with healthcare in general?
So, I definitely, as I look to the future, I see more payments through mobile device, in that, like you mentioned with Apple Pay, our credit card information is going to be, our phone is going to be our new wallet. So we'll be making payments through our phone, just using the Teladoc example. So say a patient wants to communicate with their physician, via video or a phone. Obviously, for that to really work, the physicians have to be paid, So those payment methods using like an Apple wallet or something are going to be embedded in that call of some kind with the physician via Teladoc or whatever your telehealth platform is. For these things to work, the practice has to be, benefiting, and the patient, because they're receiving, immediate help when they used to have to go in physically to a practice and, wait their turn. So I think it's great. I see that definitely in the future. Text to pay your bill. We're doing that now. Emails to pay your bill. We're seeing higher deductible plans. Patients are expecting to pay now. So we're going to see more and more patients opting into payment plans of some kind to make it affordable for themselves and the practice. So that's kind of where the industry is going.
So when you say payment plans, like a lot of people are going to have their own personal healthcare wallets, if you will. Is that what you're referring to, or
somewhat? The payment plan is, say a practice sends someone a bill of $600, and a lot of patients can't pay that in one installment. So they, through mobile, will be able to create a payment plan that auto drafts their debit or credit card each month, and until they reach that $600 balance, and they're free to move on.
This says, will payments by phone lead to more transparency for healthcare billing? You're supposed to have the millennial eyes, by the way.
I can see that. Will payments by phone lead to more transparency for healthcare billing? I think so. The challenge is as people are paying, the details. This is sensitive HIPAA information, so we got to be careful. A lot of millennials and down in generations, they're known for choosing convenience over security. Actually, security isn't something they're really thinking about. But
True.
as a medical billing company, that's the number one thing we think about, is how can we keep this sensitive information secure and also tell the patient that they owe money.
As far as the transparency in healthcare billing, I think things are and I don't know, I'm no expert in this area, but it seems to me things are a lot less transparent in hospital billing, because there's so many people that potentially have a patient care connection that the patient isn't even aware of, that they may be getting bills for. And I think when it comes from an office practice, I mean, you generally know if your doctor took labs. Yeah. You generally know what you're paying for more there than in the I think in the hospital situation.
Yeah, we see that a lot in anesthesiologists, surgeons. We send out those statements too, and they're actually not physically seeing the patient. So sometimes when the patient
they are, but then the nurse anesthetist is really spending the lion's share of the time, and also the patient's asleep too, so they don't
may not be aware of it, but they're sending a lot of statements, and the patient may call and say, "Hey, I need more information on what this was," because maybe they weren't aware of what was performed.
So perhaps we need somebody from the city to help explain bills and things like that in terms of the hospital or government, I don't know, or a hospital person. Let's see here. So can you read that for me?
Yeah, it says, why would some people prefer a paper statement showing how much they owe? So that's a great question. Again, patients over 50, and I know that's a sweeping statement, but they do prefer a paper statement, and there's just a lot of reasons for that. Some people like to tangibly hold a physical piece of paper and file it away, and that's how they prefer to pay. And other people don't. They just want.
I think it's an organizational issue. I struggle with organization, period. And so, the extent of my organization is a manila folder, and throwing a piece of paper into that folder, maybe filing it in a certain way, but doing it on the computer is a lot more challenging for me. Now, I know how to create folders and stuff like that, but sometimes even getting that email into a folder is challenging for me. I'm not very good at that. Yeah. In certain, it used to work really good with my AOL. I used to be able to dump stuff into folders, and now AOL doesn't even exist anymore. I struggle with it with my Gmail. So that's part of my problem. It's getting the information. And then also, like your banks, I mean, I don't worry about the bank stuff anymore because it's probably in the cloud somewhere, where I can just get online and get to a certain statement. But then with medical billing, I guess, or like my car or something like that, I want to put it in a file. Yeah. Because I have to keep up with it. I'm not so sure that the dealership is going to keep up with that information for me. Will y'all keep up with that information?
So, I guess in a way we would, but when we receive statement files, we store them securely on a cloud-based server. obviously just locked down.
Right, but can I get to them? If you're doing the billing solution for me and I want to review my bills in the last year.
You can. You would need to call the practice, though, and they would get it for you. Because they're pulling from their software.
So, again, I would need a paper thing to put it in a file.
Yeah.
So can you read that one?
Okay, one says, I've read that healthcare costs are one of the leading causes of bankruptcy. Are there payment plans for medical bills? Yes, definitely there are payment plans. And actually what we're seeing with medical practice that a lot of them are using cloud-based credit card solutions. And so what that does is it encrypts the patient credit card so it's, quote, on file. And so if someone calls in and they want to make a payment plan, the practice can just initiate a payment that works for them and the patient on a payment plan, and it drafts monthly, and it's, the
Now, what
bill's
happened
done.
to Target? Like, if I went to Target and I used my credit card there and they got hacked.
Yeah.
So explain what happened to Target and explain why that won't happen with you guys.
So what happened with Target is, and this is actually, it's crazy to hear this, but their HVAC company that was contracted, heating and air company.
Okay, all right.
They were contracted for all of Target, and someone had the login credentials to Target exposed, and then the hacker used that information for the breach of Target. So it actually came through a third party. So that's why, and especially in the past year, we're seeing so many people, when you're a practice and you're working with these other third-party vendors, they have to sign a business associate agreement, basically that they're going to do their due diligence in cybersecurity, making sure that breaches aren't locked down. If you look at all the breaches that happen, almost always it's because a username and password was not kept stored properly. So, it's definitely a risk, and you need to take measures to protect sensitive information.
Well, once again, Ramsey White with Innovative Billing Solutions. And I want to mention to the folks that maybe see this on a rebroadcast that Ramsey came to us because he wanted to talk about, what's going on with patient billing. And again, we want to hear from you. If there's certain topics that you want us to explore, that would be great. Tomorrow I will be with Dr. McCool. He's an ear, nose, and throat specialist. And that's going to happen around the 4 to 5:30 area, so stay posted for that, okay? Let's just see if there's more comments. How would I pay through text if my phone was stolen? I would worry about getting your phone back first. And then, you could probably find your phone now because of, what's that called? Where you
Find my iPhone.
But what if you don't have an iPhone? But somebody could find the iPhone. Hillary should have taken measures to protect her private intel like Innovative does.
Wow,
okay.
We're going there.
All right. Anyway, thanks again, Ramsey.
Thank you.
I appreciate it.
Thanks
It was a lot of fun.
It really was.
I love it. Thank you.
Thank you. See ya.